So I've got an amazing interview for you today. This goes along with my series about um, cancer awareness, specifically prostate cancer awareness. The person that I've invited to do the video with me today is Rebecca Cup. She's with Wellstar Medical Group. She is a board certified genetic counselor. Phenomenal. And just let me say this ahead of time. I didn't realize how easy and simple it was to have a genetic test. I'm almost insulted, but I'm insulted because no one told me. I didn't know. Had I have known about genetic testing, after my mother passed away in 2006, I'd have ran and had a genetic test done. So, ladies and gentlemen, let me introduce you to Rebecca. You don't mind if I call you by your first name, do you, Rebecca?
Oh, that's absolutely fine.
Fabulous. Okay. So, again, Rebecca, thank you for giving up your time and being with me. Board certified genetic counselor. It's a phenomenal interview. Thank you. Okay, let's just dive into it. What is genetic testing?
Yeah, so genetic testing is used to diagnose any type of genetic condition. And in general, if we're being very, very general, it falls into like two buckets. We've got the early in life bucket. So a lot of people don't know that you actually get a genetic test very shortly after birth. Every single baby born in a Georgia hospital gets a genetic test called the Georgia Newborn Screen. And that is looking at very, very specific metabolic conditions, conditions that affect the nervous system, conditions in the blood. And that includes a condition that probably some of your listeners have heard about, and that's sickle cell disease. And
Mhm.
the other big bucket, the one we're focusing on today, is later onset, adulthood onset, right? And so someone can live their entire life. They will not have anything different about their childhood. They will not have anything different about their teenage years. They will not have anything different for a while, but they could carry a genetic mutation or an inherited genetic change that would increase their risk for cancer in adulthood. That testing is not automatic. There's not a lot of education about it. That would just be a referral from their doctor to a genetics provider. And someone would have to develop cancer. They'd either have to have a personal history of cancer or a family history of cancer.
Sure.
And that testing would guide screening recommendations. When should someone have a mammogram or a colonoscopy? And just like you said, genetic testing. Not a lot of people know about it. The guidelines change really frequently. So I'm really glad to have this time to give some introductory information about it.
Excellent. And what's the procedure? What's involved in a genetic test?
Yeah. So most of the time that genetic test is done on blood, but we can also do a lot of genetic testing with a saliva sample or a cheek swab sample.
Okay, that easy, that simple. And again, I well, I say again, but I was totally unaware newborn babies have genetic testing done. Is
Mhm.
this something that's new? I mean, is it parent consent or what? Not to get
It's
into
n
the specifics.
Yes, absolutely. So that was, and if you ask, anyone else, they might call it like a PKU test. That's what it was called in like the 60s. But it is standardized. It is something that's done in every single state. Every state's a little bit different. But most of the time it's kind of an automatically opt-in. It's kind of difficult to opt out. And that test specifically is done on, every single person born in a Georgia hospital or different hospitals across the different states. And you are only called if that's positive, right? So
Mhm.
that's why a lot of people don't know about it. It's negative. They never find out that it was done. But yeah, but that is probably one of the most important, as far as genetics goes, the most important public health initiative and the most successful public health initiative.
Now, I know when we met, there's essentially there's a genetic test, but there's a 70 panel test,
Hmm.
right? So, what genetic test would you recommend? And again, this is going based upon family history. Mother
Hmm.
passed away of ovarian cancer, sister breast cancer, father prostate cancer, uncle, twin brother, father. So that's why I think you took me to what I would call the maximum 70 panel. But is that standard, or when you go in and ask your doctor to have a test done, they kind of basically they know. So what would you recommend?
Yeah, so hard question because there's no standard genetic testing. And again, we're really focusing on the realm of cancer, but when we're thinking about big, big genetics, I mean, we do standard testing on pregnant people, but then we have a whole nother clinic that's just for heart failure. And then we have a whole nother clinic that's necessarily standard. I would say we always try to um, do testing personalized to, what is that physician concerned for? What kind of workup have they had in the past? What type of cancer do they have, and what type of cancer is in the family? So no standard answer going to be tailored to that specific person.
Okay. How likely is it that someone would have, well, let's speak in terms of BRCA and BRCA1.
Hmm.
Um, you have a family history. That's going to tell you what the possibilities of it is that BRCA and BRCA1 would be positive, correct? If you would help me out with BRCA and BRCA1 testing.
Yeah, so I will say I'm going to go even more general. Genetic testing is just a small, small part of cancer care. And I think that's why, there's not a lot of information about it. I will say, in general, thinking about all the different cancers you could have anywhere in your body, it is incredibly rare to have a genetic form of cancer or a hereditary cancer syndrome. We think about, in general, only 5 to 10% of cancer is hereditary or due to any type of inherited genetic change. But then if you get into different types, you know, certain cancers like lung cancer or skin cancer, we think are less likely to be hereditary, less likely to be inherited. But then there's other types of cancer like ovarian cancer. We've mentioned that a few times. We find
Yeah.
something up to 25% of the time with ovarian cancer. So some types of cancer are just more likely to be genetic. And with prostate cancer specifically, we're thinking maybe 5%. With breast cancer, we're thinking maybe 10 or 15%. With ovarian, we're thinking like 25%. Pancreatic, like 10%. So really runs the gambit. But it is very rare to have a genetic form of cancer. And that's why, how likely is it? It's not likely. It's really just a tiny part of someone's workup, but it could change a lot. And I think that's why it's important to talk about.
Good. And when you say could change a lot, what do you mean in terms of treatment, in terms of monitoring? What do you speak? Good.
Exactly. Yes. So for someone with a personal history of cancer, and this depends on, everything the oncologist is going to say, what's the stage? What does it look like under the microscope? What's the pathology report? But basically, we're saying, is there any targeted therapy? Is there a PARP inhibitor? Is there an immunotherapy? Something that's not indicated based on anything else going on with that person, but could be indicated based on their genetic testing report. For someone that does not have cancer, when should they start screenings? If they have a BRCA mutation, they need to start breast cancer screening at 25. They cannot wait until 40. If someone has a genetic change that increases the risk for colon cancer, do they need to start colonoscopies at 40 or do they need to start even earlier, right? So that's going to guide those screening recommendations.
Which is amazing to me because, we start looking at numbers for men when you start having prostate exams done
Mhm.
much later. But just to hear you say for women with, a family history of breast cancer to start testing at 25 years old, wow, that's young. You know, now that I've been diagnosed with having cancer and have gone through the genetic testing, 3 daughters,
Mhm.
there's a high probability, but at the same time, it's not that negative as much as it is. Let's start testing and monitoring, correct?
Yes, and that's the real big point. Like, if you are going to take a soundbite from this, the soundbite that I want you to take is that cancer can only be treated because it can be detected early. And we can only have early detection if we have screening. And
Right.
genetic testing is just a tiny, tiny part of that screening. But if you are positive and you now are eligible for a specific treatment, or you are now eligible for early screening, that's going to improve your survival. That's going to improve your outcomes. So if I had anything to say about this, I would say if you're listening and you have a personal history of cancer, if you have an early cancer, something diagnosed before 50, or if you have a rare form of cancer, or if you just have a family history and multiple family members, the most important thing is that you should know your risk. Knowledge is power, and you should get your screenings.
And I just wrote an article about it that's being published, is that you should know your own risk.
Hmm.
You should personally know your own cancer risk. I think it's very important. Again, had I have been aware, had I have been informed, I would have started this testing back in 2006. Let's just call it 18 years ago. And again, just testing and really, I'd had the test done, but the monitoring of it and the
Hmm.
screening for cancer. So, okay, how will the results of my genetic test impact my family members?
Yeah. So most of the time when we're thinking about hereditary cancer syndromes, the majority of those are dominant, meaning that all biological parents, biological siblings, biological children would have up to a 50% chance to inherit that same genetic change. And so that would guide their medical management. When should they have screenings? Do they need to do anything additional? What are they at risk for? So they should all be tested. And then, extended family members, they should consider genetic testing just to clarify what is their risk and what should they do to decrease that risk as much as possible.
Good. So, just for the viewers, I went to Rebecca. She provided me with a very nice, comprehensive folder with the results, and then went as far as typing up a family letter. And it says for relatives with your relatives was recently seen in the office. So essentially, here's a letter that I sent with the results out to my children for them to pass on and give to the doctor. My genetic gene is the ATM, which is a mutation of that gene. Saying it correctly?
Yes.
And so that's going to also help in the treatment of my cancer by knowing this in advance, knowing this up front. So I think it's hugely important that, my encouragement to a lot of people, if you have that family history of cancer, but just not to get off base here, the genetic testing also helps with heart disease, or does it?
Yeah, so I will say we're answering very specific questions. So I think that's the biggest misconception for listeners is they say, "Oh, I want a big test. I want to know about everything." We can't really do that. For heart specifically, we do work with the heart failure clinic, but really what we're thinking about there is we are testing for individuals with very specific changes to the structure of their heart and the structure of their heart muscle or their
Mhm.
aorta or specific electrical changes in their heart. So in that case, it's really not as much as a preventative as it is, is there a genetic reason why? Are there medications that are indicated or not indicated? Do they have any indication to have an implanted device like a pacemaker defibrillator or something like that?
Okay. But I just don't want to turn people off that says, oh, well, cancer doesn't affect my family. I can let me end the interview. There is other genetic testing that, could pertain to their family or family members, correct?
Yeah, absolutely. And like for women, you said, 65% of your listeners are women. For women nowadays, and I think this started around the 2010s, there is standardized genetic testing during pregnancy as well.
Oh, wow. I didn't know that. Okay. That's phenomenal. Good. I've asked you all the questions that I was going to ask. I always say, here's a closing statement. I like to also know, because it wasn't part of what I forwarded over to you, what's your why? What's your motivation? How did you get down this career path? I think what you do is phenomenal, along with I think you're a phenomenal individual. So, how did you get on this path?
I actually worked in a research lab for a while and I just miss talking to people. And I always like science and I really like chatting with people. And I kind of just fell into it that way.
Is that right?
Yeah.
Good. So when I went to the meeting, I'm in my head, man, and I did notice something. I'm just going to bring it up real briefly. So you walk in, and there's a real nice conference table, and I sat down, and there's a box of tissue there. I didn't know if that was intentionally for me, but I was having one of those days, and I'm like, oh no, and you were so comforting and helping me with it. Phenomenal. What's your closing statement? What's your encouragement to individuals with a family history of cancer? Help me out.
I would say this and I'd say it again and I'd chant it from the rooftops. I would say, know your risk.
Yes.
Knowledge is power. Do your
Yes.
screenings.
There you go. Knowledge of power. Know your own risk. Rebecca Cup, I want to thank you so much for joining us. I hope
And the last thing I will leave you with, if you have a personal history of cancer or a family history of cancer and you want more information about genetic testing, genetic resources for cancer, I would go to www.facingourrisk.org.
awesome. Thank you
Yes.
so much. Hopefully, I'll be able to circle back around to you sometime. All right.
Thank you. Thank you for letting me be here.
Oh, excellent.